was going to ask you, so is any other testing to do? Because you mentioned the alpha-fetoprotein, the ultrasound. Tell us more about how to, what will involve the liver screening.
Yeah, so liver cancer screening is simple in some ways and complex in other ways. So liver cancer screening, the mainstay of liver cancer screening involves a simple, non-invasive abdominal ultrasound. The same testing that one does in pregnancy. The abdominal ultrasound is really to look at the liver itself, to take a look for liver nodules. And one combines this with a blood test called alpha-fetoprotein that can be elevated in the setting of liver cancer. So those two tests are non-invasive, relatively simple to perform. The quote-unquote complexity comes in the fact that this has to be repeated every 6 months. And the reason why this needs to be repeated at such a frequent interval is because patients with chronic liver disease, hepatitis B or cirrhosis from any etiology, really have such a high risk of developing liver cancer, approximately 2% every year. And so we need to continue to monitor them closely to find these liver cancers at an early stage. Because as we'll talk about, one of the key things is liver cancer can have a very good prognosis if one is found early. And it's very different in terms of prognosis if one is found at later stages. Now, these sort of interventions, ultrasound and alpha-fetoprotein, have been the mainstay of liver cancer screening for many, many years. And there is ongoing work to find new strategies to find liver cancer at an early stage, whether more complex imaging strategies like MRI or new biomarkers, new blood tests to look for liver cancer at an early stage. Those are in early stages of evaluation. Right now, once again, liver cancer screening is routinely done using ultrasound and alpha-fetoprotein.